Due to the current COVID-19 pandemic, we have created numerous changes in the office for the safety of our patients and our staff. We have made numerous enhancements to our infection control protocol, and we have instituted several social distancing strategies. Although social distancing while performing treatment is impossible, we have instituted several changes from our original office flow to allow for social distancing. The purpose of this short movie is to allow you to understand our interim patient visit process. We expect this to change and go through several phases, slowly getting back to our customary appointment process. We will base our phase back on the guidelines from the Center of Disease Control and the Ohio Department of Health. Because of our shutdown, nearly 7 weeks of appointments were canceled and now need to be rescheduled. We have a systematic approach to rescheduling our patients and hope you can be patient while we work through the rescheduling process. It is our goal to schedule all of our patients over the next 2 weeks and see them all over the next 4 weeks. We have added numerous additional days to accomplish these goals. Step 1 is the scheduling process. You will receive a phone call from our office to schedule your appointment over the next 2 weeks. During that call, COVID-19 screening questions will be asked similar to the screening questions sent in the May 10th COVID-19 email. There will also be an addendum to our informed consent for you to sign. Before coming to our office, make sure you wash your hands, brush your teeth, and take your temperature. Step 2 is to call once you arrive in our parking lot. Our interim measures have eliminated our waiting room. Our parking lot is now our waiting room. We have also created measures to limit the time you spend in the office. Once you arrive, you will call our receptionist, who will review our screening questions and have you enter once we are ready to take the patient directly to the treatment chair. With our goal being to limit the numbers, ideally, the patient would come alone. We understand that there are times when this is not possible. We request that all entering the office wear a mask. Ideally, you would bring the signed informed consent with you to the office. If you forgot, no worries, we have additional forms available. Step 3 is our temperature screening. All guests to the office are asked to wear masks throughout the visit, with the exception of the time spent being treated. All individuals, including staff, are screened with questions and by having their temperature screened. Every person entering is required to be fever-free and not have any signs or symptoms of COVID-19. If the assessment suggests signs and symptoms exist, the patient will be asked to follow up with their physician and reschedule in our office no sooner than 14 days. The patient will then be escorted to the treatment area. Please note that our bathrooms and our brushing station will generally be closed. In step 4, we will perform the treatment of the patient. Essentially, there are 4 areas where patients will be seen. 2 areas in the main treatment area, 1 area in the private room, and the final area in our records room. All proper PPE is used during the appointments, and our disinfecting process has built-in redundancies. As you can see, we have a great plan in place to mitigate the risks and advance your treatment safely. We understand that this is a time of great fear and that some prefer to wait to come back in. We want you to come in once you are ready and feel comfortable. Essentially, as soon as the patient's temperature has been taken, they'll be taken directly back to the chair where they'll be treated. In the treatment area, if they're treated in the main area, there'll be at least one chair in between them and the other party. Occasionally, we have families where more than one person is undergoing treatment. Those are the exceptions to the rule, where they could be seated right next to one another. Remember, there is still a chair between them and the other party. Before treating the patient, all proper PPE is worn. Also, all chairs are thoroughly disinfected between patients. For all of our patients, we are concerned with the prolonged period you have gone without a treatment visit. So we encourage a visit. For those who are not yet comfortable, there are alternative options, such as a virtual checkup by way of texting photos to our email account. We have a video on our Cast Ortho YouTube channel and have posted a link in our Facebook to help guide you through the task of taking photos. Step 5 is the dismissal. Our assistants will fill out a visit summary describing what we have done, how the patient is doing with oral hygiene, and when we'd like to see the patient for the next visit. On the back side of the summary will be a copy of the informed consent you signed when coming to the office. The patient will then be escorted out. We have specific pathways in the office to continue the social distancing. The majority of patients will return to their car and call to make an appointment. If a parent has come in with the patient, there is the option of scheduling at the front desk. Step 6 is to schedule your next visit. If you remained in the car during the appointment, ideally you would call before leaving the parking lot to schedule the next appointment. We anticipate that your next appointment will fall closer to our conventional process. However, there is a chance that this process above will continue. It all depends upon how this COVID-19 pandemic progresses. We can only hope that it goes away quickly. Please continue to watch your email and consider following us on Facebook. At Cast Orthodontics, it's more than a smile.